So in today's video, we're going to be talking about what is TMS therapy like. With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So, doctor,
what is it like?
What is it like?
What is it similar to?
Similar to?
Well, outpatient therapy, first of all, is preferable.
Yes.
For patients. They can go and come and go as they please. It's a daily process. We need consecutive therapy. There's a commitment. Patients have to come every day, 5 days a week, 20 minutes a day. That's a commitment. Same time each day, just to get across town for some patients. They work, their kids are in school. Everyone wants the morning hours before 9. They want the after hours after 3. Makes a lot of sense. So there's those issues of just logistics. But the benefits are, in our view, so great. And so the improvements can be so dramatic that once we get patients through the first couple days or weeks of treatment, they aren't missing their appointments.
Right.
In some medical therapies, as an oncologist, for example, treating brain tumors, there's side effects with therapy. And the patients would, begrudgingly come in for their treatment. It's different with TMS. Patients like the TMS therapy. They see it making changes. It happens fairly rapidly, and they want to come in for treatment.
Okay.
They'll fight over their time.
Yes. Yes.
And in our clinic, we do a personalized form of TMS called PRTMS.
Okay.
And that personalized form allows us to treat more than one location. We treat 5 locations during a 20 minutes or 30-minute time period. So each day we're addressing multiple regions on the cortex. We turn down the intensity so you can hardly feel it, and we give more dose. And then we adjust the dose based upon the response.
Right.
Like all medicine should do. You give a dose, you look at response, you make adjustments. And that's what we do on a weekly basis using an electroencephalogram. And that looks at the brain state, looks at the waveforms, and we can learn a ton from the waveforms.
That's the EEG, correct?
That's the EEG.
Okay.
So that is a daily therapy with a machine, and there's a weekly EEG done.
Right.
And so in combination, we're making adjustments every 5 days and tuning the brain.
Okay.
Like an instrument. And it works faster, it's more durable. And our patients, I think, enjoy the fact that they aren't wearing hearing protection. It doesn't feel like a woodpecker on your head.
Right.
Like standard TMS, they can hardly feel it.
So it is a commitment. Full disclosure, this is something that I personally did with Dr. Murphy. And with the EEG, that was something that I found, that was the most exciting day for me to get down. I had to drive an hour and a half to get to this man's office every day, which was a commitment for me. I'm not a commuter at all. But driving down was something I was committed to do this. On EEG day, I was always excited to get down there to see my scores, to see my peaks. Did I form some peaks this week?
Yeah.
And it was like an additional motivating factor to get my butt down there and get my brain scan that day.
Yeah, there's 2 things we see in patients when you do the electroencephalograms. They are a mathematical spectral picture of the brain state. It's hard to fake. It's math. We take your brain frequencies in multiple locations and we plot it. The frequencies tell you how the brain's behaving in that region. So when patients come in and first see that there's disruption, it corroborates their own feelings.
Yes.
Here's someone telling me, here's what your brain looks like. It's not your fault.
Right.
Okay, you're anxious because you got all this anxiety on the scan. The system's going too fast.
Right.
Hey, you're depressed because the area's going too slow. Again, it takes some of the burden off. Why am I behaving like this? Well, here's why.
Right.
Here's how your brain's actually performing. Right? So as you treat the patient and see that it physically changes, that creates a lot of, I think, enthusiasm, as you mentioned, and excitement for, hey, I'm seeing a physical change here.
Not only do I feel better, but Dr. Murphy is showing me right here why I feel better.
Yeah, I think one of the common things I hear from patients is, you're the first doctor that's ever showed me what my brain looks like.
Yeah.
MRIs and CAT scans show you a snapshot of the brain. It's a photograph.
Right.
It's a picture of the anatomy. Electroencephalograms show you how's that brain behaving over time.
Yeah.
Over 4 minutes, how's that area behaving? And we do a 4 to 5 minute scan. It's wireless, gel-less, Bluetooth, takes 4 to 5 minutes. And that weekly data, though, tells us a lot. How is the brain performing?
And that's what separates you from standard TMS. That's what makes it PRTMS.
True. Yeah. Every week we do this, every 5 treatments.
Right.
And we look at the brain state. And then the information flows back into our treatment algorithm and makes a decision on a binary tree. Do we go more intense? Do we go more or less intense? Do we change the frequency? Do we keep the frequency? It'll make there's 7 different parameters of therapy, and it goes through a pecking order and decides how to accelerate and maximize the process, which shortens the amount of therapy needed. Okay. So the faster I can get a patient to a solution, the better. And we can get faster to a improvement by taking constant feedback and looking at the brain.
Oh, and from the client showing up the 5 days a week.
Absolutely.
To that process.
Patients ask me, if I come 3 days a week, is it enough?
Right.
And I tell them generally no.
Right.
I mean, I don't want to start somebody off with a handicap of only having 3 days. That's like saying I want to run a marathon and I'm going to just work out 3 days a week.
Right.
You can do it, but you're not going to be like somebody who
right.
comes in 5-6 days a week. Same with like physical therapy. It's the same idea. Think of your brain in TMS getting brain physical therapy. It's better if it's every day.
Yeah.
And the more consecutive, the more the quicker we see a response. And
so is it traumatic if somebody misses 2 days, and that's 3 days through the process?
Yeah, that's asked a lot too. What if I can't come Friday?
Right. Something happens in life.
Will that affect my therapy?
I can't show up.
I tell them the same thing. I say, I prefer 5 consecutive days a week. If you miss a day here and there, it's not that relevant, as long as you go right back to 5 days and try and maintain that. Right. Just like working out again. If you go to therapy 4 days this week versus 5, not much of a difference here. Mm-hmm. But someone taking a 2-week break or so in the middle, that's where we start seeing, hey, we're going to be starting over when you come back.
Hey, guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.